Welcome, everyone. A special welcome to you, Uncle Volcano. First, what does volcanic smoke contain?
Volcanic smoke is a complex mixture of gases and very fine solid particles. Its most important components are primary gases. Water vapor makes up the largest proportion, often more than 90%.
Welcome, everyone. A special welcome to you, Uncle Volcano. First, what does volcanic smoke contain?
Volcanic smoke is a complex mixture of gases and very fine solid particles. Its most important components are primary gases. Water vapor makes up the largest proportion, often more than 90%. Carbon dioxide, a suffocating, heavy gas that can accumulate in low-lying areas and pose a deadly risk. Sulfur dioxide, one of the most dangerous components. It has a pungent smell like a burning match and is the primary irritant to the respiratory system and eyes. Secondary and harmful gases. Carbonyl sulfide and hydrogen sulfide, toxic gases that smell like rotten eggs in the case of an affect the nervous and respiratory systems. Chlorine and fluorine gases, highly toxic and polluting gases. They can combine with volcanic ash and contaminate water sources and soil, leading to poisoning of livestock and plants. Hydrogen and carbon monoxide, flammable and toxic gases. Solid particles. Volcanic ash. It is not ash in the literal sense, but rather very fine, sharp particles of pulverized rock and volcanic glass. It contains various minerals like silica, which causes the disease silicosis, and sometimes toxic heavy metals such as arsenic, mercury, and lead. Acidic aerosols. When sulfur dioxide combines with water vapor in the atmosphere, it forms sulfuric acid in the form of very fine droplets, creating volcanic smog (VOG).
How does it affect the body's health?
Check this out, Dr. Ashraf. The effect of volcanic smoke on health depends on several factors, the most important being concentration, duration of exposure, age, and the person's underlying health condition. 1. Effects on the respiratory system. Most common. Irritation and inflammation. Sulfur dioxide and fine particles cause irritation in the nose, throat, and bronchi. Immediate symptoms: coughing, wheezing, shortness of breath, bronchitis. Worsening of chronic diseases. People with asthma, chronic bronchitis, or emphysema are at risk of acute and serious attacks. Symptoms can escalate from a simple asthma attack to respiratory failure. Long-term damage. Continuous exposure to sharp, fine particles ash can cause lung scarring, pulmonary fibrosis, and chronic respiratory diseases like volcanic silicosis. 2. Effects on the eyes and skin. Eyes. Contact with gases and ash causes severe itching, redness, tearing, and a feeling of grit in the eyes, conjunctivitis. Skin. The acidic and fine particles can cause skin irritation, especially for people with sensitive skin, leading to redness and itching. 3. Effects on other body systems. Cardiovascular system. Very fine particles can enter the bloodstream and cause systemic inflammation, increasing the risk of high blood pressure, heart attacks, and strokes, especially in the elderly or those with pre-existing heart conditions. Nervous system. Hydrogen sulfide gas at high concentrations can affect the sense of smell and cause headaches, dizziness, and in severe cases, central nervous system depression, leading to loss of consciousness and death.
Who are the most vulnerable groups?
Children and the elderly. Pregnant women. Those with chronic respiratory or heart diseases. Outdoor workers and athletes.
What is the prevention tips?
Prevention tips. 1. Stay indoors. The best way to prevent exposure is to stay inside buildings with windows and doors closed. 2. Use masks. Not all masks are effective. Regular surgical masks do not block fine